Hi guys, so welcome to another MRCP PACES video. Today we are talking about examiners of the examination and how to win them over. Okay, so I have obviously done lots of videos on many different stations in the exam, and I will be linking them over this area of the videos for you to check out if you haven't seen them already. Today we are going to specifically talk about examiners and your strategy to maximize on the examination by thinking about what your examiners are expecting from you, okay, and how to make their jobs easier. So for those of you who don't know me, my name is Dr. Vishal Kumar. I have set up this channel and also keenmedic.com for medical education purposes. If you want to know more, do check out my channel and also keenmedic.com. Let's get started. I want you to think very simple, okay? So think about what the purpose of the examination is, okay? So it's all about career progression and about making excellent doctors, right? That's what it is about. So what are your examiners trying to achieve? Are they trying to just make you a bit more skilled, or are they trying to make the consultants of tomorrow? Are they trying to make excellent leaders in clinical medicine of tomorrow? That's the question. And how can you help them achieve what they are trying to achieve? Okay, we know that, as a candidate, as a student, we all know that we are trying to achieve things, but what are they trying to achieve? Stand in their shoes. Let's pretend you have done PACES, okay, and now you are the examiner and you are examining somebody who is about to do PACES. What would you be looking for? That's the question, okay? That will make answering the question so much simpler. And if you can answer these questions, then you will know how you need to perform, all right? So what are they trying to achieve then? Let's think about this. So they're trying to find the medical registrars, okay, who they can trust, and who they can trust to a few things. Keep the patient in front of them at the center of their care, okay? So to prioritize the patient above all, that is the key thing that they want, and to run the acute unselected medical take, because in a lot of hospitals within the UK, you will have to be the medical registrar on call, regardless of what specialty. Most specialties will require you to do general medical on calls, and on those on calls, you will be the medical registrar on call running the acute medical take, and you will get everything through the door, okay? They want someone who they can trust to be able to handle all the things that they're going to experience, that they're going to face. Be time effective and time efficient. So being time effective is trying to achieve results in the time that they have. Time efficient is doing the task smoother, okay? So that's what the two phrases mean. So this will be the case for when you are managing your patients, but also managing the team that you are with. Being knowledgeable, but also being aware of their limitations. So as I said earlier, they are looking for medical registrars. They are not looking for you to be a specialist the moment you graduate PACES. That is not what they're looking for. They are looking for medical registrars that they can count on, who are decent in terms of their knowledge, but also are aware of where they need to draw the boundaries in terms of their own limitations, okay? And being aware of when they need help, and also to ask for this help. It is no good knowing that you are out of your comfort zone, that you are out of your depth, but not actually asking for help, because that is dangerous, okay? There may be times in your PACES scenarios, whether that be in communication, station 5, history, whatever. You may be put in situations where you are out of your depth. It is beyond your capabilities to deal with a certain situation. And in those situations, you need to recognize this fact and ask for help, okay? This help may be from your own consultant, from other specialties, from ITU, from the multidisciplinary teams, from your nurses, physios. It can be anything and everything. It just depends on what the situation is. But just knowing and also asking for help is also important as it is to be able to run the medical take or manage your team or manage an acute emergency. All right. So these are the things that they might be looking for. So how can you help them achieve all of these then? So I'm going to give you a few questions to think about, okay? So these are the questions that you should have in your head all the time that you are practicing PACES and also during your examination, okay? So the first one is, how can I show I care about my patient? The reason why I've put this first is because a lot of the times candidates are very good at being able to take a history or examine a patient. However, they can fall short of showing compassion and empathy towards the patient, and that is where they lose a whole lot of marks and actually fail the exam because they can't show, or they didn't show, that they care about the patient. It just shows when you are putting your agenda above the patient, above what the patient is saying, what the patient is worried about, then you will fail the examination, then you will fail the station, and you won't earn the trust of your examiners or your patients. And that is why I've put this first. But all the points in this slide are just as important as the others. Next, what is the most serious condition I need to rule out now? Okay, the key phrases being most serious and rule out now. So there will, of course, regardless of the presenting complaint of the patient, you will have a whole list of differential diagnoses, okay? But in that entire list, you need to think about what is the most serious thing. So what could kill the patient, okay? What could kill the patient in the immediate future? This is important. And that's what you need to be thinking about and how you can rule it out, okay? It may be through examination, it may be through simple tests, it may be through advanced tests. It just depends on what the situation is, what the differential diagnosis you have is. And you need to be thinking about how you can achieve this. And what is the most likely diagnosis and how you can confirm it. So most likely diagnosis and most serious condition are not necessarily the same thing, okay? For example, a patient with shortness of breath, the most likely diagnosis may just be the fact that they have got an early onset of asthma, okay? Or that they may have a low-grade chest infection, of which they are not compromised from. But the most serious condition you might have to think about is whether they might have a large pulmonary embolism or they have got a pneumothorax, okay? So these are the things that you need to think about. And how you can confirm it. Similarly, as I said earlier on, this may be simple tests or advanced tests. And what is the chronic management of the condition? Now, a lot of the conditions that you may see in PACES are going to be mixed, okay? So some of them may be acute, some of them may be chronic, some of them may be much more combined, in the sense that a patient with COPD, which is a chronic condition, might come in with a shortness of breath, and then you need to manage them. However, the management extends beyond the acute management, okay? So a patient with COPD who is still smoking will need smoking cessation advice. So you should think about referring them to the smoking cessation team if the patient agrees. You should think about putting them on inhalers after their acute therapy has finished, okay? After their nebulizers and steroids are finished, you should think about putting them on regular inhalers. So this kind of thing. What is chronic management? Do they need follow-up? So this is the kind of thing you should be thinking about. The next thing is whether you need to organize more advanced investigations and make referrals, okay? So advanced investigations can be advanced blood tests, advanced imaging, CT, MRI, nuclear medicine, anything, all of it, okay? Making appropriate referrals to other specialties, depending again on what the patient might have. say, let's take COPD again as an example. If they have got severe COPD and their PO2 is low, right, they might need referral to the long-term oxygen team so that they can install oxygen at their home. And they might need referral to the palliative team, who can then follow them up and provide adequate medication to manage their shortness of breath at home. Okay, so that kind of thing. These are the sort of things that you need to be thinking of. These are the questions, okay? And if you can think of all of these questions every time you do your scenarios, then your examiners will be very impressed by you, because they can see that you're not only considering the patient from a care point of view, but also the acute and chronic management's point of view. Okay, so I hope that you found this useful, guys. I've written a book by the name of ACE PACES, Strategies for High Achievers for Just Like You, and it is now available on Amazon. And of course, you can also learn from PACES Course Online, which has got everything there. Both the links to the book and the course will be down below in the description. I'll see you in the next video.